There's been another coronavirus-related death at Sydney's Newmarch house. It's the 17th at the troubled aged care facility, bringing the total number of coronavirus-related deaths in the country to 98. Reporter Jessie Dorset joins us now live from Sydney. So Jessie, just take us through the details of what's known about this latest death there at Newmarch house.
G'day Miriam, we've just learned that 92-year-old Fay Rendoth died yesterday. She's the 17th resident from Newmarch to die after contracting coronavirus. Her family has released a statement and I just want to share some of that with you now. Fay's granddaughter says her story is a real love story. She grew up in the Blue Mountains, which is where she raised her family until she moved to Newmarch very recently. She leaves behind 3 daughters, 8 grandchildren and 3 great-grandchildren. Her granddaughter says she was a very sharp and quite healthy for her age. She tested positive to coronavirus 3 weeks ago at Newmarch, but didn't really show many symptoms. She says that the lack of physical interaction was detrimental to her health and it was heartbreaking not being able to spend time with her grandmother in her final days. But the family has thanked all of the staff at Newmarch for their care and compassion that they showed towards Fay Rendoth.
And Jessie, what is the latest on the situation there at Newmarch House?
Yeah, there's now been 69 people at Newmarch who have contracted coronavirus. We understand that's 32 staff and 37 residents. An independent advisor, an external advisor, was appointed earlier this week. He's come from Catholic Healthcare and he's there really to provide advice and a bit of transparency, more transparency for the families. We know that the Aged Care Quality Commission had warned Newmarch that it could lose its licence if it didn't address a number of issues. So that will be the external advisor's job to help do that. We are expecting a press conference from New South Wales Health Minister Brad Hazzard in the next few minutes, so we'll learn more then about the situation at Newmarch as it currently stands.
After the Prime Minister unveiled the National Cabinet's plan to exit lockdown, some states and territories are further easing restrictions from today. Well, for more on this, let's go to our political reporter Matthew Doran in Parliament House at Canberra. So Matthew, just take us through the steps that are being used to bring life back to what we hope will be as close to normal as possible in the weeks and months ahead.
Yeah, there are some guidelines, Miriam, as to how the nation can start reopening its doors, but each state and territory is going to adapt and adopt them specific to their own circumstances. So, for example, step 1, which some states are already putting in place, has things like allowing outdoor boot camps to kick off again, but it doesn't go as far as to say that gyms will reopen. That's something that might be considered 3 weeks or so into the future if there doesn't seem to be a spike in the rate of infections. When we talk about cafes and restaurants, step 1 does allow for them to reopen with rules about how many people can cram into indoor venues, but certain states are going their own way. For example, New South Wales still has a ban on dining out, whereas South Australia will start to allow outdoor dining from the beginning of the week. Northern Territory going one step further and announcing that their pubs will be open from next Friday. So each state and territory is looking at these guidelines and putting them in place specific to their own requirements. Step 2 is something that will start being looked at in the coming weeks. That starts to see more, or the numbers of people allowed for outdoor gatherings increased. It also looks at things like cinemas reopening and some interstate travel before we get to stage 3, which is what the Prime Minister wants to see the nation hit by July, where most restrictions will be lifted, and that's when they can start talking about the idea of a trans-Tasman bubble, so that opening of the international borders just to New Zealand, not other countries, with the Prime Minister saying that that is unlikely to happen for much of the rest of the year. So the Prime Minister is citing Treasury figures, hoping that 850,000 jobs could be restored as the nation starts to reopen once more. But it does depend on how the different states and territories approach this situation and the timeframes that they are working to.
Well, Matt, amid those various decisions that are being taken around restrictions, we've had some tensions on show again between Commonwealth and the Victorian government in particular.
Well, Liberal backbencher Tim Wilson on this very network earlier today took a swipe at Daniel Andrews, a Victorian Premier, saying that he was acting too slowly in lifting restrictions in that state. Mr Andrews said on Friday after the National Cabinet meeting that he wanted to take some time to figure out how to start lifting social restrictions in Victoria, and it's reignited this debate about tension between the federal government and the state government there. Scott Morrison and Daniel Andrews have always said that they have a good working relationship, but the tension came to the fore when Dan Tehan, the Federal Education Minister, told the ABC last weekend that Daniel Andrews was taking a sledgehammer to children's education by not opening the state's schools in line with many other states. He walked back from those comments, but Tim Wilson today has again suggested that there is a disconnect between federal and state politicians. He has said that Daniel Andrews has a lot of explaining to do when it comes to why he's delaying lifting restrictions in this state.
I've just outlined some serious questions I think that Dan Andrews needs to answer for Victorians if he wants to maintain public confidence. Because I think, and there is actually now a narrative that's building in parts of Victoria where people are increasingly concerned that he's probably enjoying the clampdown too much in terms of the authority and power it's given him, and he's not as enthusiastic to roll it back.
Our political reporter Matthew Doran there from Parliament House in Canberra. Some of those forced into mandatory quarantine as part of the COVID-19 pandemic say they've been left traumatised and claim their mental health needs were overlooked. One woman in Melbourne who suffered a miscarriage while in quarantine told ABC Investigations she was taken to hospital but was left traumatised after she was forced to go back into quarantine for 5 more days. And Gilles Fisher, who stayed in a quarantine hotel in Sydney, says calls from on-site staff for help were ignored after he suffered severe panic attacks. The Sydney Local Health District has since apologised.
They do check on you every day saying, how are you dealing with quarantine? And I was fine, they've said, do you want to speak to a psychologist? And I was fine until I actually had the attacks. But then when you have the attacks, it's, 3 days on the waiting list to speak to a psychologist. They don't have this on the moment now. You suffer from that anxiety attack, and we have this process to deal with you now, not next Wednesday,
Now, the World Health Organization has warned that countries must continue to focus on surveillance to stop the spread of coronavirus. It comes as many countries, including the US, Germany and Australia, have turned their efforts towards reopening economies and easing restrictions.
We need to get back to public health surveillance. We need to go back where we should have been months ago. Finding cases, tracking cases, testing cases, isolating people who are tested positive, doing quarantine for contacts. We have seen time and time again in countries that have contained this virus and brought it under control without the need for massive lockdowns, have done it through the application of principled, human rights driven, but sometimes quite aggressive public health surveillance.
The US unemployment rate has risen to almost 15%, the worst figure since the Great Depression of the 1930s. As the pandemic continues to upend life and the US death toll nears 78,000, economists are warning things are likely to get worse. North America correspondent James Glenday has more.
April might go down as the worst month for jobs ever in the history of the United States. More than 20 million were lost in a single month. That means that the unemployment rate, which just 2 months ago was at a 50-year low of 3.5%, has now risen to 14.7%. As you mentioned, the second highest rate since the Great Depression of the 1930s. And this thing isn't even done. One of the interesting things, I think, when you look at the jobs data that's out today and when you dig into it, is that more than 3/4 of all Americans who are unemployed say they're just temporarily unemployed, a sign that they want to get back to things pretty quickly. But economists are warning that although they might think they're temporarily unemployed, things aren't going to be normal for a long time. Even when states reopen, social distancing measures in places like restaurants are still going to be a big thing. Businesses are going to rethink how they actually operate, and therefore some of those temporary unemployed are likely to become permanently unemployed, and recovery is going to take some time. The White House was asked about this very thing today, and Donald Trump's press secretary, Kayleigh McEnany, said that the administration had no other choice but to shut the economy down, and she again praised how Donald Trump had handled things. Here's a little of what she had to say.
We had to put a stop to the economy. It was a pause. This wasn't some, economic catastrophe that organically happened. It was decided upon by the President of the United States to stop the United States economy because we had to save 2.2 million lives, perhaps more, somewhere in that range, because American lives, that's what mattered most.